for anyone that doesn't know me, my name is McMillan. I'm the CEO for HEABC. I've been that for about 18 months now. Previously was with Northern Health, providing care in rural communities and Prince George in a range. A number of years ago, about 3 or 4 years ago, I did health talks, Pechakucha presentation by the BC Patient Safety Quality Council at their conference. I followed a 12-year-old girl who was unbelievably amazing, and I made a note at the time to never follow a child again. I'm going to add to my note that never follow Minister Dix when he talks, because Minister, that was I've seen you talk a number of times and you're just amazing, and what comes through is the personal touch, and I really appreciate that. Innovation and flexibility. I actually had a number of topics that I wanted to talk about, and slowly crossed them off today as I listened to the speakers, because there were all sorts of ideas. And I'm going to shift what I was going to say on the fly and talk about some of the challenges I see around being innovative and being flexible. And I'm going to push back a little bit on some of the perceptions about innovation and flexibility. So the first thing I want to say is, I think one of the things that really holds us back from being truly innovative is our beliefs about what we can and can't do. And so I heard both here and in the last 3 or 4 months where I've been meeting with all sorts of employer groups and getting ready for the next round of collective bargaining, I heard today, and I've heard it consistently in talking to employers, about their beliefs on how the collective agreements do not allow them to be flexible. And I know it may seem strange that the CEO for the organization that's responsible for bargaining collective agreements might have this perspective, but I want to push on that. I want to say, I don't believe, by and large, the collective agreements are the barriers that people think they are. I'm not saying that there aren't things that could be improved in the collective agreements. I'm not saying there aren't things that could be improved in how we work with partners in the system. I would say we can improve that immensely. But many of the very specific examples that people give me about the things they can't do in the system, the innovative, creative things they want to do, their belief is wrong. They have the flexibility, they are allowed to innovate, and we need to challenge that understanding of that as a barrier. So when I hear that, I actually get to the why do people think that is a challenge. And I think a couple of people today have talked about the space for creativity, the space for innovation, the support for it. And one of the things I think is a real barrier is how fast and how intense and how stressful the work is right now. This is not like other industries. So a lot of other industries, when they have a big change initiative, can either slow down or sometimes even stop and transition to something new. You can move from an old factory to a new factory. You can stop production on a Friday, you can move over a week, and you can open up on the next, following Monday, a week away, and ramp things up. Everybody in this room knows you cannot stop in healthcare. I was responsible for hospitals, home support, public health, mental health, residential care, assisted living. There was nothing, very few things that could actually stop, train the staff, support the staff, give them new skills, and then start up again, and we all know why. So the challenge before us is, how do we support change in a different way? How do we create space? We know of other industries where staff and managers and leaders are given time to be creative. Who in the room has been given time, dedicated time, to be creative in the last year? Two, three. How many people here, Daniel?
170.
175, 3 out of 175. That is a challenge for us. Industries that support people with time and resources to be creative, get creative ideas. So if everybody's working flat out, one of the things that people use, or one of the strategies people use to cope when they're not being innovative, they know they need to be. I don't think anybody doesn't know that their change is needed. More creative ideas around recruitment, more work around retention. Everybody knows. I don't talk to anybody in the system that doesn't know that things need to be different. But they're working so hard, and they're feeling like they can't, and they look for reasons why that can't happen. So we sometimes pick a reason. It's hard. They'll say you can't do it in the collective agreement, when in fact, there's just a process in the collective agreement. We need to support people to understand those processes. We need to support people to work through them. And we need to support people to understand what their flexibility is. And so that's something that HEABC can do. I heard a lot about safety. So a long time ago, when I was 23, I worked in a smelter, and somebody over there asked me what a smelter was. A smelter is one of those factories that, big furnaces and molten metal and all of the really, really big pieces of equipment that can really, really hurt people. 23, university student, went into this smelter, just a recipe for disaster, really, because I had never worked in any place like that before. Nothing even close. And the very first day, I spent the entire day in a safety orientation. And then I spent the next 4 days in other forms of orientation. This is before I actually started working. I was being paid, I was an employee, but they didn't let me touch anything, they didn't let me go anywhere until I had a safety orientation first, and then the rest of the orientation around the company and policies and procedures and those things. I know when staff start in many of our public institutions, the health authorities, I'm less familiar with what all of the private providers do, but I suspect it's very similar in many of them. When staff start, your need is so desperate that it can be a while before they get to orientation. You might get, here's a manual, there's the fire exit, there's the washrooms, there's the cafeteria on your first day. You might get that. I'll tell you, in some of the facilities I ran, it could be 2 months before people went through their full orientation. We're getting better, but we're not perfect around that. And I'm saying that not as we just need to put people through their safety orientation and that'll fix everything. To me, that was indicative of a culture that took safety seriously. I was a pharmacist in my clinical career. I worked at VGH, I worked at Peace Hospital, I worked in Prince George. I never thought about safety. I had home care staff that would go to a house in Prince George that I had to sit the staff down and say, you will not go there. Because the RCMP won't go there without 2 cars and 4 members. And those staff told me, that's our job. The staff told me, there's someone there who needs my help. The staff's thoughts were only about the patient and not about themselves and their safety. And it wasn't until we had a conversation around, well, what if something happens to you? It's not, that house and that client there is not your only they're not your only client. You've got all these other clients you provide care to. So I said, yes. Well, if you get hurt, what happens to all of them? It wasn't until I could actually almost say, if you get hurt, other people will suffer. It wasn't, if you get hurt, you will suffer. We have to change that orientation. When I worked in the smelter, I knew who was responsible for my safety. I was responsible for my safety. The supervisors were responsible for the safety. My colleagues, my teammates, everybody was oriented around safety. So shifting that safety culture is a really, really big thing. The very last thing I'm going to say is, I think what's really critical for supporting innovation and change, really supporting change management in a way that we totally need to do, and we do such a poor job of, and there's so many examples of poor change initiatives, is we need to support and invest in leadership in a far different way. We need leadership to have the time to do the things that are important for change management. We need leadership to have the time to be the example around a safety culture. We need leadership to actually have the time to breathe. We need people to want to be in leadership because it's such a grind, and many people in this room know the grind of leadership. Frontline leaders are struggling. If your frontline leaders are struggling, if your middle managers are struggling, how can we expect the system to innovate? How can we expect the system to get better? How can we expect the system to support staff to want to come to work? So that was my time. I could go on about all of those topics. Again, I want to echo what others have said and just thank BC Care Providers for allowing me to be part of this panel. Thank you.